Welcome to all of you in this session of Tips and Tricks of Pharmacology with me, Dr. Saurabh Bhatia, your pharmacology guru. So tip number 4 for you people is there are 3 or 4 important topics which is maybe related to the PSM also as well as pharmacology, which examiner is asking very frequently in your recent exams. So one is the treatment that is given on the mass skills, that is a HIV treatment. So treatment of HIV, all drugs are important as well as the treatment regimens are important. How to do the post-exposure prophylaxis, how to prevent the vertical transmission, and how to treat a patient of HIV comes to you with co-infection. Particularly this year, this is very important to know the post-exposure prophylaxis. So treatment of HIV is very important. All the guidelines are important as well as the treatment of malaria. So National Vector-Borne Control Disease Program, we have our treatment of malaria in that. So treatment of malaria recently asked very frequently in your exam. So this is again important for this year exam. Number 3, the topic is tuberculosis. You must be knowing India is a country where the tuberculosis is very common. You should be knowing each and every drug of the tuberculosis, especially the first line, the second line drugs. And this year they have started asking questions on MDR and the XDR TB drugs. You should be knowing the basic regimens, the important regimens like the BPAL regimen, BPAL-LM regimens. These are the important regimens that you should be knowing for the tuberculosis. So tuberculosis, HIV and malaria are 3 very important topics for this year exam because the questions are recently asked and you should definitely get 1 or 2 MCQs from these 3 topics. Stay tuned with such kind of tips and tricks in pharmacology.